Difference between online and offline consultation, where you can see my results. Important examinations before rhinoplasty. Difference between online and offline consultation. The main difference is I recommend to do online consultation before offline, because during online consultation you will understand more each other, patient, client and surgeon. You will understand the vision of beauty of your future result. You can explain what you want, and maybe your surgeon cannot give you this result, or your surgeon has another opinion. So at the end of online consultation, you can have final modeling, you can have conclusion about your CT scan, about your ultrasound examination, about your blood test, if you did it before, and important, you can have primary price for your surgery. Your surgeon will understand the duration of the surgery, technique, he will understand more or less which technique he will use for your surgery. By himself or his assistant can calculate you the final price. And during offline consultation, you can speak more about your nose. You will make professional photo shooting with professional camera and professional lenses. Then, together with surgeon, you will make your final modeling. And your surgeon can touch your nose, can feel the elasticity and tension of the skin, and he will understand more about, for example, special techniques to stabilize the tip of your nose, to change the projection of your nose. And of course, during changing the light, during the photo shoot, he will understand irregularities and asymmetries of your nose. And together, you should analyze your CT scan, all the problems that you can have after the surgery, to avoid these problems, to avoid the complications. So both of these stages are important: online consultation and offline consultation. Where you can see my results. My results are everywhere. I have 7 pages on Instagram. I have Facebook, YouTube, Telegram channel. For example, I'm using Telegram channel from 2011. So for all these years on Telegram channel, and you will see the link, I have more than 3,000 pictures, more than 2,000 videos. On Instagram, I have previous old hashtags. You can find my previous old results, noses that I did 12 years ago, 10 years ago. Now I focus on my new results. I have my new pages and they are open. All of my results are open on social media. I did a lot of online surgeries. These online surgeries you can find on Instagram. IGTV it was before, now it's Reels. And you can see video of my surgeries on YouTube. My prices are open all of my career. You can find my price on my website. You can find my price on my Instagram pages, my working Instagram pages. You can find my price on my Telegram channel. You can always ask about the price of my assistant, but it is always open. First, look on the price. Is it comfortable for you or not? How much consultation cost? What is the general cost for like rhinoplasty, for facelift, eyelid surgery and other surgeries? During the consultation, during online consultation, we discuss about your future nose, about your future results, and then you will have your invoice. In this invoice, you will see all types of the costs, my doctor fee, and also you can see that all taxes includes. And you can discuss your surgery, you can discuss your future booking of your surgery with your personal assistant. You can plan your visit 2 days before the surgery. 1 day before the surgery, we will make offline consultation. Also, you can do blood tests, you can do special examinations like CT scan or ultrasound examination if you didn't do it before the surgery. For the surgery, I do not recommend to smoke cigarettes 1 week before the surgery. Of course, if you're not a smoker, it's perfect. I do not recommend to drink a lot alcohol 1 week before the surgery. Try to drink less. If you take any kind of medications, please tell us before, because we need to discuss this also with anesthesiologist. Depends on type of your skin, depends on difficulty of your surgery, which we will discuss during online consultation. We can recommend you to take special medications before the surgery. But to know this, you need to have online consultation before the surgery. After offline consultation, you can have your final time for the next day for your surgery. After online consultation, when you will have the surgical plan and invoice of your future surgery, you can plan your surgery. You can ask for the available dates for your surgery. So you should write to assistant that you are ready for the surgery. You should make prepayment. When you will make prepayment for the surgery, you will get the data for your surgery, for your future surgery. And then you can plan your trip. You can visit me 2 days before the surgery, or for example 1 day before the surgery if you have all the important examinations. We will make the final photo shooting and video shooting with correct lights, with correct lenses, and we will discuss your final future shape of your nose, and you will know time of your surgery for the next day. If you don't have all of the examinations, you should come 2 days before the surgery, and you can do blood tests in clinic, you can do CT scan and an ultrasound examination in the clinic. And then 1 day after the surgery, the next day after the surgery, you can fly home or you can start traveling in Italy. Important examinations before rhinoplasty. First of all, it's blood test. In most clinics, in most countries, all the tests are the same. For example, here you will see the list of the most important parts of your blood test examination. The next important examination is computed tomography. It is better to have computed tomography before your offline consultation, before you will visit your surgeon. So you need to have it during your online consultation. But if it was not possible for you, you should do your CT scan before the surgery and discuss everything about your nose. Discuss your CT scan with your surgeon before the surgery. The next examination that can be useful for you is ultrasound examination. Ultrasound of the skin. You can see the derma, the epidermis, SMAS layer. It is important to understand to see the shape of your bone, to see the shape and position of the cartilages, and to see all the layers of your skin, because then we can compare before and after picture of your ultrasound, and we will know, do you have swelling of your skin, or maybe swelling of your SMAS, or maybe we will have the scar tissue or not. My opinion, the modeling of the future result can be predictable, and we can see the final future result of your rhinoplasty. The first modeling you can do during online consultation, and you can decide is it good for you or not, is it good vision of your future changes beauty or not. The final modeling should be done during offline consultation with the correct lenses, with the good camera, and with the good professional light. How I use CT scan for future modeling. I combine CT scan, 2D, 3D and future modeling, and I know exactly where and how much I need to cut the cartilages, I need to cut or move the bones, how I need to move the tip or to change the position of tip cartilages, so you can see your future nose. It can be some changes of your nose, like changes between your modeling picture and real nose. Of course, it can be, but it can be changed for 2-3 millimeters because of the swelling of the skin. Bones and cartilages, they will not swell. but skin of course can swell. So 2-3 millimeter changes can be, but the main vector, the main shape, you will see. I do not recommend to make modeling by yourself, because when you will do these changes by yourself, you don't understand can it be real or not. When surgeon do the modeling, he understand can he move the bone or can he make these changes. Is it real to have this type of your tip or not? So please don't do it by yourself. You should do your modeling together with your surgeon. CT scan is one of the most important examinations before the rhinoplasty, because compared to endoscopy, on CT scan we can see all the structures together and we can make 3D modeling of your nose. So it is very important to see CT scan before the surgery, and we need to have CT scan in a good quality. This is also very important. Today we have a lot of good software, and with this software we can open these DICOM files and we can analyze all 3 layers of 2D CT scan and then make 3D CT scan. So after your examination you will have CD disc or maybe flash card with the information of your CT examination, or you can ask to send you the link, and this link you can send to your surgeon. I recommend you to save your CT scan for the future. It can be useful for you. And also after the surgery, after 3, 6 months, 1 year, we can compare before and after data of your CT scan, and we can make all the measurements and compare the stability of the structures, the symmetry of your structures, and maybe if you will need correction on maybe some changes, it will be also very useful. So 100% you need to have CT scan, and your surgeon should see your CT scan before the surgery. Ultrasound examination, it is a new type of the examination in rhinoplasty. Most of the surgeons, they don't use this examination, but I recommend try to use it. You can ask radiologist to make the special scans of some parts of your nose. For example, dorsum part, tip part, like different planes, sagittal plane, coronal plane and axial plane. On these planes we can see all the layers of the skin, and we can see the position of the cartilages, we can see the shape of the cartilages, we can see the shape of the bones. Yes, CT scan will be more informative in this way, but good ultrasound examination can show you all the millimeters of these asymmetries and deformities, and only on ultrasound examination you can see all the layers of the skin and you can make the measurements of these layers, and then it will help you after the surgery to understand do you have swelling or not, and if you will have swelling, in which layer you have this swelling. So try to do this examination, it will be very useful for you. There are a lot of rumors and misunderstanding in these topics. Let's talk about open and close rhinoplasty. The main difference between open and close is that during open rhinoplasty, surgeon opens here your nose and you will have the scar here. It should be invisible. In the good hands, it's invisible scar, but sometimes it can be visible. I don't really like open rhinoplasty because of the swelling of the tip, swelling in supratip area, but I know surgeons who are doing well the open rhinoplasty. But because of this scar, I like to do close. I do close rhinoplasty from 2015. It's more difficult because you're doing everything from the nostril inside. I do this in special loops with 3x magnification. I see everything because I'm also ENT surgeon and I'm a plastic surgeon. It's easily for me, but it's difficult. Yes, it's really much more difficult and maybe for someone less visible. Now let's talk about structural and preservation rhinoplasty. For many surgeons and also for you, preservation rhinoplasty it's a marketing tool. It seems like new type of the surgery, but it's not. The most famous preservation techniques they used for 70 or maybe 80 years. Now it became more popular because of the Instagram, because of the TikTok. The main idea of preservation rhinoplasty is the preservation of the some parts of the dorsum. So it's preservation osteotomy. But when you do the tip, what you can preserve? Sometimes you can preserve the ligament, sometimes you can preserve the shape of the cartilages, you can change only the position of the cartilages, the angles of the cartilages, but already you will change a lot of things. So it's not really like preservation. Now let's talk about popular words like piezo rhinoplasty, laser rhinoplasty, or I don't know, nano rhinoplasty, 3D rhinoplasty. It's marketing words because it means that surgeons use or try to use some of the devices that you don't know. There is no laser rhinoplasty because which laser you will use, or ask your surgeon to show you this laser or how he will use this laser, but it's just marketing tool to get more money from you. Piezo rhinoplasty, it means that you use piezo device for the osteotomies to cut your bone, but your bone is short. You can cut the bone with microsaws, with mechanical or electro microsaws. You can do beautiful osteotomy with classical sharp osteotomes. If your surgeon use piezo rhinoplasty, it's fine, it's great. But first of all, you want to have beautiful nose, not beautiful piezo nose, laser nose, or 3D nose. You need to have beautiful nose. How you will get your future beautiful nose? With which device? It's not your choice, it's the choice of your surgeon. First of all, you should think about beautiful future result. In my practice, I have piezo device, I have microsaws, electric microsaws, manual microsaws, all types of the osteotomes. In different surgeries, you should use different instruments. Every nose is unique, every nose is different. You should think about your future result, not about the device. I'm ENT surgeon and plastic surgeon. My first 5 years in my career, from 2008 till 2013, I did only ENT surgeries, and then I started to do rhinoplasties. So I know what is it functional ENT surgery. I know how to work with the septum, I know how to work with the sinus, I know how to work with inferior turbines, medial turbines, and other elements. I know all the dangerous zones, so I can treat your functional part of your nose during the rhinoplasty. About septum deviation and septoplasty. All of us, all people in all the world, they have deviated septum, more or less, like big deviation, small deviation, but all of the septums are deviated. We don't have anything like completely straight in our body. So every radiologist, they can write you that you have deviation of the septum. But why usually we are not breathing well, especially at night and in the morning? Because of the swelling of inferior turbines. These two elements, they swells and constrict the septum. They block the septum, they block the airways. Because of your horizontal position, the blood goes to your head, and these two elements, they swells. So the most popular surgery in ENT is turbinoplasty. There are some types of turbinoplasty, how you can change the shape, the volume of these elements. You should speak with your surgeon how you will treat this. Also, you can see the size and the shape of these elements on CT scan or maybe during the endoscopy of your nose before the surgery. So when you will speak with your surgeon, when you will speak with ENT, when you will speak with me, I will show you on CT scan, do you have like special changes? Do we need to change these parts of your nose, these elements? And if we need this, how we will change, which technique we will use for your future surgery. At the end of the surgery, you will not have nasal packages and you will breathe immediately after the surgery. Sometimes I'm using silicone splints. If you have very deviated septum, crooked or deviated asymmetrical nose, and I like change all the elements, I put into the new position, yes, I use these silicone splints for 2 weeks. They are small, they're invisible, they're inside of your nose. You can breathe with them, but they will stay for 2 weeks, and after 2 weeks you need to remove them. Our anesthesia is the best. You will have fantastic trip and you will have beautiful dreams and you will have fastest recovery in your life. You will not have any vomiting, you will not feel any pain. Why? Because it is the combination of the best medication and the best equipment, and of course with the best anesthesiologist. That there is no secret medications in all the world. So in the best countries, cities, in the best clinics, you can have the best medications. But this best medication will be the same in Paris, in London, in Milan, in Berlin. But what does it mean good anesthesia? Anesthesiologist, he is like a barman. So you can have the best drinks. But the good barman can make the bad cocktail and you will feel bad yourself next morning. So anesthesiologist, he should know how to mix these best medications and he should give you this best cocktail. That's why it's impossible to have test for the anesthesia, because it is the combination of different medications. Before the surgery, you will have consultation with your anesthesiologist and you will discuss, you should discuss everything about your future anesthesia. You should trust your anesthesiologist. You should trust anesthesiologic team and clinic, and everything will be okay. Also, during the surgery, we use BIS monitoring. It is the special equipment device which control the deepness of the sedation. So we will see how deep you sleep, and it is impossible to feel something during the surgery because all the system will see it. We see how your brains works. We see, do you see the dreams during the anesthesia or not? And at the end of the surgery, I tell to my anesthesiologist, we are finishing. Now you can start to wake up the patient. And we start to wake up you. You will wake up, you will smile, you will see immediately your nose. You can breathe with your nose because I don't use nasal packages. It will be no swelling, no bruising, no nasal packages inside. So new beautiful nose with the best anesthesia. Which surgeries you can do at the same time with rhinoplasty? If we are talking about face surgeries, of course you can do brow lift, you can do eyelid surgeries sometimes, but I don't really recommend haloplasty. It depends of the shape of your columella, it depends of the shape of your nostrils, because if you will have the tension here after the surgery, it will give you visible scar. You can do neck lift surgery, and sometimes if it's not too difficult, if it's not too long, the facelift surgery. So you should calculate how many hours will be the anesthesia, because during the rhinoplasty you need hypotension, you need low blood pressure. If it will be for too long, for too many hours, it will be not good. If we are talking about other surgeries, yes, we can do rhinoplasty with breast augmentation, with general, simple breast augmentation. If we are talking about mastopexy, if we are talking about breast lift, It depends on the difficulty of your breast. I don't do abdominoplasty, I don't do liposuction, so I cannot tell you about these surgeries. With me, with my team, your rehabilitation will be very fast. At the end of the surgery, you will wake up without nasal packages. You will breathe with your nose immediately. You will not have swelling, bruising, or bleeding. You will have only skin color tapes on your nose. I don't use the cast. Sometimes I'm using silicone nasal spleens and I put them inside the nose if it was very deviated septum or crooked asymmetrical nose. I will tell you, if you will be my patient before the surgery, will you have it or not, and you should remove these silicone spleens 2 weeks after the surgery. Then after the surgery you will go to your room and you will stay in the clinic 2-3 hours. After 2-3 hours you are free. Of course, you can stay in the clinic if you want, but you can go to the hotel. And next day after the surgery, you can fly home. Your flight takes like 2-3 hours. If it's longer, I recommend to stay 1 day more and then you can fly home, because it is easy for you to remove the tapes by yourself. That's it. You will not need to remove any stitches, because I use closed rhinoplasty and all the stitches they dissolve by themselves. You will have your personal assistant and you will chat with your personal assistant. After 1 week you can make online call. After 1 month you should just send the video of your nose. So as you understand, your rehabilitation will be very fast and you will feel any pain. With the most modern techniques, instruments, you can use your glasses, your sunglasses 2 weeks after the surgery. If you are using light glasses, you can use them 1 week after the surgery. Yes, maybe your nose is special and you will need like special medication after the surgery. Already we will give all the medication for you and you will have everything for your rehabilitation period. But if you have special nose, yes, we'll maybe recommend you something special. For example, to wear the tapes 1 week or 2 weeks more. If you have thin skin, you will have very fast recovery period and you will have final result 1-2 months after the surgery. If you have thick skin, we will recommend you special medication, maybe special cosmetologic procedures to make thinner your skin, and then your final result will be 5, 6, sometimes 10 months after the surgery. Next day or 2 days after the surgery you can fly home. 8 days after the surgery you should remove your tapes. It is very easy. You will have special information from your personal assistant how to do this. Then you can use your tapes 2-3 weeks more during the night. And the first checkup, online checkup, should be 1 month after the surgery. You can make this checkup with your assistant. You should visit me, or we should make online checkup with CT scan checkup 6 months after the surgery, because maybe you will need or you want to have like any type of corrections of changes of your nose, and it will be possible, or maybe you need to do it earlier, so we need to have information about your nose. So the most important checkups are 6 months after the surgery and 1 year after the surgery. Before and after we can talk online. If you're living far away and it's difficult for you to travel, of course we can do checkups online, don't worry about this. There are different types of complications. There are like general surgical complications. They can be in any type of the surgery in medicine. It is infection, necrosis, bleeding, other complications. I'm lucky I didn't have it and I don't want to have it in my practice. But if you mean complication is some types of asymmetries, I don't know, like changes or deformations of your nose, Yes, it can be, because we don't know how the skin will heal after the surgery. We know more about the bone, about the cartilages, but skin healing recovery is not so predictable, because skin is the biggest organ of our body. Who are treating the skin? Dermatologists. So please be in contact with assistant, be in contact with me, with your surgeon after the surgery. And if you will need any help, any correction, maybe it is like slight asymmetry of the cartilage, maybe of the bone, correction can be done. Yes, we can correct it easily, for example, by local anesthesia, and it will take 5 or 10 minutes. Don't worry about this. The best surgeon is the surgeon who knows how to deal with complications, how to correct something, because of course, all of us, we have beautiful, great surgeries. But what to do if something going wrong during the surgery or after the surgery? So, surgeon should have big experience in his practice. He should read a lot, he should travel a lot, visit congresses, meetings, speaks with his colleagues to know everything that can happen in rhinoplasty world, during the rhinoplasty. When you can do the correction? Of course, if it is asymmetry of the cartilage, you can do the correction 2-3 months after the surgery. If it is the asymmetry of the bone, you need to rasp the bone, maybe to make some changes. I recommend to do this 4, 5 or 6 months after the surgery. Depends of the data from CT scan or maybe from ultrasound examination. But it is possible. Don't worry about this.